Hello everyone and welcome to our online demonstration of Luna EMG. Today I would like to show you a short presentation. At the end of the presentation, just some features of the device that I think are quite interesting and would love to share with you. Okay, but first let's start with a presentation. Luna EMG is a robot for both neurological patients, but also for orthopedic patients. We use it also with oncological patients or with the kids. And the main feature of the device is the EMG triggered movement. This is the most unique one because we use the EMG activity to assist with the movement. That means that patient, even with the slight activity of the muscle, is able to work very actively. Let me show you that on the patient. So you can see this is a spinal cord injury patient with some activity in his upper limb, but without visible movement, right? So what we would like to do, we would like to take this activity and change it for a movement. And here's a patient working with the device. You can see we've put the electrodes on his biceps and on other ones as well. But here we are using the EMG from the biceps. And wherever he is active, he's above the threshold line, we are able to see that activity on the screen, and the device is helping with the movement if he is active enough. Good. And why this is so important? This is important because only the active participation contributes to significantly higher activation of the sensomotor network. And this is comparing to the passive movement. So we always want the patient to be active. And if there is no movement, sometimes this is just hard, right, to work that way. But here, this is possible. And with Luna, the active participation can be easily achieved and the patient is able to move. And also why repetition matters. The large dose of practice may be required to produce the lasting neural changes and to optimize motor control. And we've seen that on the device that, for example, if we work with the patient, we're able to go with the shoulder extension, for example, 60 repetition during 10 minutes. This is possible with the flexion and extension of the shoulder. And the study shows that it's usually around 32 repetitions per hour where we work with a stroke patient. So this amount of repetition might be not sufficient enough to gain the neural changes, to gain neuroplasticity changes. And what else we are using as approach in our device? So as I mentioned, the neuroplasticity, right? So through a lot of repetition of the same movement, we want to change the neuroplasticity. We want to influence that. And we want to also work with our patients through motor learning. So that's how we teach the patient, where we show the patient how to contract and relax certain muscles. Then the patient is actively learning how to perform the movement. And this is how we achieve the results even after one session with the patient, because then the motor learning is occurring. Obviously, there are certain indications to use the device, and there will be muscle force, it will be muscle coordination that we can improve, or range of motion that we can improve. This is all possible with the device. There are assessment tools that we can work with the patient and assess the range of motion, muscle force, proprioception. This is all also included in the software. And there are different features out there. So as I mentioned already, the EMG assisted movement, but there's also passive movement. There's only, for example, EMG biofeedback that you can also use with your patient, or different kind of resistance exercises. And as I mentioned before, there are some assessment tools that you can use with your patient. There are different extensions to work with the upper limb, the lower limb, the steering wheel. This is something also that I can hopefully show you live. We can work with the lower limb as well. So as you can see, the device is not only working with a certain limb, but it's actually, you can work with the whole body, right? So with the upper limb, with the lower limb, with trunk, you can use EMG electrodes to work with different kind of muscles, for example, even with the facial muscle. So this is something that you can use as well. We try to work by ourselves with patients as well, just to gain a lot of experience ourselves. And for example, we had this stroke patient here that had a frozen shoulder and it was very painful. And he was working twice, 3 times per week with the device for an hour. And we've been working on a lot of things, but one of them was the shoulder extension and flexion, and shoulder abduction and adduction, right? So here are examples on how he was working with the device. So here was the passive movement, but also he was working with the EMG activity, with some resistance exercises. This is all what's going on here during the sessions. And you can see the difference. This is before two months of working with Luna and after 2 months. And we were kind of comparing how the range of motion has changed, because again, there's a lot of pain out there, and the patient has issues with flexing and abducting the limb. There's still a lot of things to work with, but there was improvement out there, definitely. And we had those stroke patients working with a lower limb. So they were working on the activity of their rectus femoris, of their hamstrings, using the EMG trigger movement. And the improvement was also visible during walking, right? So this patient started working with Luna, and he was on the wheelchair at the beginning, but at the end of the 6 weeks work in the clinic, he was already walking independently. And other stroke patient who was working more on his upper limb. Before, he was 4 months in the hospital and nothing was changing. And then he started working with Luna, and he could easily see the improvement right away. And it influenced the function, because he was able to make his own sandwiches and just pick up the things with his hand, which was not possible before. Also, we did our own study with Luna. So we took 30 patients. They were working like a standard therapy plus 30 minutes per day on Luna. And the other group had only standard physiotherapy. The amount of time between those groups was the same. And what we've noticed after 6 weeks, that there was an increase of the tight circumference and a higher decrease in spasticity over time. So this is something you also ask a lot about, like, what about the spasticity? Can I work with the device where there is spasticity? And yes, you can do that. And plus, it will decrease the spasticity, right? So you can see on the graph here how the control group, there was also improvement in terms of spasticity, but the robot group was way better in that term. We've been working with Guillain-Barré syndrome, and for example, here a lot with the foot drop. The patient was very excited that he improved during 4-week time. You can check out our YouTube videos in regards to those patients that I'm mentioning here. And really was happy that the rehabilitation went so quickly in this good direction. So Luna could work with this kind of patient as well. We have the experience with spinal cord injury patients. This is a patient that had a car accident, And when she was working with the device, she could really understand better how she should contract, relax her muscles. Here you have her already after 3 months of working with the device. So she was able to already hold a limb and control it, right? And so she was working with the device in the lying position. So the electrodes here, you can see they were placed on her hamstrings. And she was also looking at herself in the mirror just to have the additional feedback on how she is actually working with her lower limb. And also she has been working in sitting position with electrodes on the rectus femoris. Yeah, so after another period of working with the device and with some standard therapy as well, she was able already to make a movement, to control that movement, to even hold it in some positions when we ask, go, hold, right? So because there was some motor learning and neuroplasticity processes that took place. And obviously also the increase of strength, range of motion, muscle coordination, and it all influenced her everyday life. We had patients with the Duchenne muscle dystrophy, so kids working with the device where we have games, this is exciting. So yeah, kids love the working with the feedback on the screen. And also I mentioned already there are some assessment. For example, it's always better to use the objective tool to see if there is, for example, some activity in the upper limb. So the patient that you've seen at the beginning of the presentation, he had activity in his muscles, but he was also assessed with the subjective measurements like the MRC scale. And it was assessed with the 0 point, for example, for his triceps or pronator teres. And on the EMG, we could clearly see that there was some nice activity that he was able to control. So, just to be more precise, this is always better to use some additional tools to see if we are assessing the patient right. Yeah, we also have very nice therapist reference they like to talk about. So the physios really see that using the tool improve the patients, right? They can see that there is increase in muscle force, range of motions, right? So this is obviously very crucial. That thanks to Luna, we can go with motor learning, and because it has the biofeedback, the patient is focusing on the external feedback, and it's a lot of repetition, it's really intensive, so it really pays off at the end. We are not making mistakes while assessing the patients, and this is also very important. And the way of using the device, right? That there has a lot of options that you can use with different extension, working in different joints, using different therapy tools, but assessment tools as well, makes it kind of like a Swiss knife that you can work with your patient. And on the other hand, it's not the price is really competitive. In comparison to other systems on the market is really, really okay. And other features that we have here is also that because it's on the wheels, you can work with the in-bed training with your patients. Those are examples of how we can adjust Luna to the in-bed patient, right? So this is also something you can use in your clinic. As I mentioned before, there are different games. We have 4 games at this point, but we keep adding them. So with new updates, you receive new games. And you can work with different kind of extensions. So again, depending on what you want to work with. There are clinics that they get more devices just to have it more like a group setting. And then you have one physio who is operating more devices, so you can be more effective. And we have, I guess, over 130 devices installed all over the world. So we try to gather all the experience and share with you. And whatever you get the device for your clinic, we come, we train, we try to support you with all the knowledge, all the materials that we have. We cooperate in terms of different researches. So if you would like to also go that way, cooperate with us, we would love to do that. So you can contact us via email or a phone just to let us know that you would like to get the device for the trial, try to work with the device with your patient, and cooperate in a meaningful way. Great. So again, this is our website. Join us there, send us an email, contact us. And in the second part of this demo live training, I would like to shortly show you the device, how it looks like, how it works, and some features that you might be interested in. All right. See you in the second part.
Хорошо. Теперь давайте перейдем непосредственно к устройству Luna EMG. И позвольте мне показать вам, как вы можете работать с разными типами пациентов. Итак, во время презентации мы сказали, что можем работать с пациентом, у которого есть некоторая активность в мышцах, но нет движения. Для этого мы будем использовать упражнение «Нажать и удерживать», которое является уникальной функцией устройства. Сейчас я покажу, как оно работает. Итак, у нас есть ЭМГ на бицепсе пациента, и мы откалибруем его. Попробуйте немного согнуть руку, попробуйте активировать его. Хорошо. Итак, мы оставили верхнюю конечность вне устройства, чтобы просто показать вам, как это работает. Но очевидно, что пациенту следует находиться внутри насадки. Итак, когда мы просим пациента «попытайтесь сделать движение», попробуйте сжать конечность, то насадка идет вверх. Попробуйте немного поднять конечность снова. Какая бы ни была активность, даже небольшая или выше пороговой, она поможет пациенту активно работать. Устройство будет поддерживать конечность во время движения. Но что делать, если нет ни активности, ни движения? В таком случае мы всегда можем работать с пассивным движением. Устройство обеспечивает пассивное движение, и мы можем настроить его под пациента. Мы можем изменить скорость. Мы можем установить паузу в конце или в начале упражнения. Это то, с чем мы можем работать со всеми типами пациентов. Мы также используем режим CPM в качестве своеобразной разминки перед другими упражнениями. И мы также можем видеть активность мышцы во время пассивного движения. Так мы можем воодушевлять пациента оставаться активным даже во время выполнения пассивных упражнений. А что если у пациента есть активность и движение, но мы хотим работать над его силой? Мы можем выбирать из различных упражнений с разным сопротивлением. Например, у нас также есть такое упражнение, где мы должны просто выполнять очень простую задачу. Пациенту нужно перейти к синему квадрату и остаться там, например, 2 секунды. Потом немного вверх, а затем снова найти другую цель по мере ее изменения. Это очень легкое упражнение даже для пациентов после инсульта, которым иногда трудно понять различные виды игр. Поэтому это упражнение подходит для них идеально. Сопротивление будет регулироваться в зависимости от скорости движения пациента. И таким образом мы можем работать с нашими пациентами, чтобы увеличить силу и проприоцепцию. Еще вы спрашиваете, трудно ли все настроить под пациента? И как сменить насадку? Это быстрый процесс. Итак, вынимаем руку из насадки. Далее мы просто устанавливаем насадку в вертикальное положение и вынимаем ее. Это первый шаг. Очевидно, второй шаг — поставить другую насадку. Например, рулевое колесо. Мы просто вставляем ее, и все. Вы готовы к работе. С насадкой рулевое колесо вы можете более функционально работать с туловищем пациента или с верхней конечностью. Если мы используем такую насадку, мы можем выбрать некоторые игры. В устройстве Luna у нас есть 4 игры. Мы можем настроить диапазон движений для работы с нашим пациентом и выбрать одну из 4 игр. Итак, давайте выберем игру «Пузыри». Надеюсь, вы можете видеть ее на экране. А пока наш пациент работает с игрой, позвольте мне рассказать вам немного о других насадках, которые мы можем использовать с нашими пациентами. Если у пациента есть, например, падение стопы, мы можем отрегулировать насадку для стопы и работать с пациентом с падением стопы, также используя пассивный режим. Или движение, запускаемое EMG, или выполняя упражнения с сопротивлением, или даже используя игры. Решать нам. У нас есть очень хорошая насадка для плеча. С ее помощью вы можете работать над сгибанием или отведением-приведением, в зависимости от потребностей вашего пациента. Это очень важно, чтобы мы приспосабливались к пациенту, а не наоборот. Это означает, что нам не нужно думать, подходит ли мой пациент для этого устройства. Мы просто подстраиваем пациента под устройство. У нас также есть насадка для нижней конечности, с которой мы большую часть времени работаем с коленом в положении сидя или в положении лежа. Также есть очень хорошая насадка для пронации и супинации, при помощи которой мы можем работать с нашим устройством. Вы также всегда спрашиваете, что делать, если у пациента нет хватки? Мы придумали эту перчатку, с которой вы можете работать. Вы можете надеть ее на пациента, и тогда он сможет работать с насадкой в такой перчатке. А еще у нас есть набор для трудотерапии. Сейчас я его покажу. Это что-то вроде чемодана, в котором мы храним различные насадки для трудотерапии. Сейчас открою. Здесь у нас самые разные насадки для пронации и супинации, но уже с другими ручками-захватами. Например, по типу ключа или двери, или чего-то вроде отвертки или открывания банки. Все это насадки для трудотерапии. Также мы можем работать с тазовым дном. Для этого у нас есть такие электроды для активности тазового дна. Это также один из способов работы с устройством. У нас есть специальный набор различных электродов для тазового дна, которые вы можете заказать вместе с устройством. Я думаю, мы показали большинство наших насадок. В Luna EMG также есть хорошие оценочные тесты. Вы можете проверять EMG-активность, можете проверять силу мышц, можете проверять диапазон движений, можете проверять проприоцепцию. Это специальные тесты, предназначенные для оценки ваших пациентов. Существуют также различные виды упражнений, например, в которых вы можете работать так, как если бы вы работали с упругим сопротивлением или с поднятием тяжестей. Поэтому у нас есть все еще много вещей, которые мы бы хотели показать вам во время презентации, посвященной специально для вас. Вы можете взять устройство на пробу в свою клинику и посмотреть, как оно будет подходить вашим пациентам. Мы будем рады связаться с вами по этому вопросу. Звоните нам и давайте знать, если вы хотите протестировать устройство в вашей клинике. Мы будем рады сотрудничать с вами. Хорошо, на сегодня все. Спасибо за просмотр. Будем на связи. Пока-пока.